there, my name is Ella White, and I am a pediatric nurse practitioner student, and I'm the one that's going to be examining your cute baby today. So first off, thanks so much for coming to see me for their newborn visit. I'm going to go ahead and jump straight into the newborn exam. If you have any questions along the way, feel free to stop and ask me. That's totally fine. So I'm just going to go ahead and get into it. So let me lay them on the table right here. So first things first, what I'm going to be looking for is just making sure that your baby has an appropriate tone, making sure they're moving all their extremities, making sure they're not in any pain from moving around, and that their movement is symmetric. So what I'm seeing right now looks great. I'm also just looking at their color overall, making sure they're not showing any signs of jaundice. Sometimes if they have an underlying condition that causes them to have lower oxygen, they may be a little bit bluish. I'm not seeing any of that. Your baby looks great, healthy. Skin is nice and pink. I'm going to check capillary refill, so just pressing down right here and seeing how fast the color returns to their skin. That's looking great. So I did a peripheral capillary refill and then central capillary refill. We're just going to press down right here. And right away, while your baby's nice and quiet, I'm going to go ahead and listen to their heart and lungs, make sure everything is sounding okay with that. So let me go ahead and listen to their heart. Okay. So just listening to a couple different points on their heart, making sure I'm not hearing any murmurs. It is common for newborns to have a murmur about 24 to 48 hours continuing after birth. And that is a sign of a structure in their heart called the PDA, or the ductus arteriosus, I'm sorry. The ductus arteriosus is closing. And I'm not hearing that, so your baby's seems to have closed and resolved. Her heartbeat sounds great. Now I'm gonna go ahead and listen to her lungs, make sure she's not working too hard to breathe, make sure I'm not hearing any kind of junky sounds in there left over from birth. So let me go ahead and do that. And I'm gonna go ahead and just listen on their back as well. Okay, awesome. So she is sounding great. So now that the hard part's over with, what I'm gonna do is just start by going from head to toe. And once again, if you have any questions, feel free to let me know. So we'll start with her head. I'm just feeling her two little fontanelles. So I'm just feeling her anterior and posterior fontanelles. Both of those feel great. They're open and soft, not bulging. They're symmetrical. I don't feel any overlapping sutures, which are the little plates in their skull. So that's all a great sign. I'm not seeing any birth injuries. Examples of that include something that's called caput, and that's basically a pooling of the blood under their scalp from a birth injury, but all that is looking great. Now I'm just visualizing her eyes, her mouth, her nose. Eyes are both clear. I'm not seeing any drainage. I'm gonna go ahead and take my tool right here and just shine a light into her eyes, making sure I'm seeing that fundal reflex. And you may have heard that called a red reflex in the past. So that is great. Then her nose, I'm just gonna make sure that both her nostrils are patent or open, making sure she can breathe out of both of them. That looks great. I'm just hearing clear breath sounds right there. Looking at her mouth, I'm not seeing a cleft. I'm gonna go ahead and take my gloved finger and stick it in her mouth, just checking for a cleft palate. Not feeling that. Just feeling around for any neonatal teeth, anything like that. But her gums, her tongue, her palate all look great. I'm not seeing a tongue tight either, which is awesome. Not seeing any other common neuron findings like Epstein's pearls, anything like that. I'm just going to gently turn her head to this side and to this side, making sure she has full range of motion there. So that's great. I'm not seeing any signs of torticollis. Moving on, just looking at the ears, making sure they're looking symmetrical, no abnormalities or dysmorphic features there. We already did the lungs and heart, so I'm just going to move on down to her tummy. So before pressing on it, I'm also going to listen to that as well. So let me listen real quick, just make sure she has active bowel sounds. Okay, her bowel sounds are active in all 4 quadrants. Her umbilical cord looks great. I see that it's healing great, no signs of redness or infection around that area. I'm also going to be palpating her liver, just making sure the edge does not extend beyond her ribs. That feels great. I'm not feeling an enlarged spleen or anything, which could be another sign of illness. I didn't feel any masses or anything like that. Moving down to her diaper area, are you okay if I checked that? Okay, perfect. So just making sure that her genitalia looks good, her hymen and labia look good, her clitoris and urethra. I'm not seeing any signs of abnormality there. And then has she been pooping? Okay, perfect. So we know that her anus is patent. Moving on, while we're in this area, we're going to do what's called the Barlow and Ortolani hip test. So this is testing for something that's called hip dysplasia. So I'm just going to press forward here and open, press forward and open, and that motion went smoothly. I did not feel any clunking motion. I didn't have any difficulty with that. So now I'm just going to go ahead and gently flip her over. And what I'm looking for here now is to make sure her spine is symmetrical. That looks great. I'm not seeing a sacral dimple, any hair tufts. Everything looks intact and straight along the back of her spine. And finally, I already mentioned her skin, so no rashes or anything that I can see. Any ones that you have concerns with? Okay, all right, that's perfect. And then last of all, I see that she's nice and alert, so that is great for her neuro status. She's moving around. I'm just going to do a couple quick newborn reflexes, and that is just making sure that those reflexes are intact and her neurological system is working properly. So there's a couple different ones you can do. I'm going to start off by stroking the inside of her palm. This is called the palmar or grasp reflex, and she's doing great. She's sticking her or clasping her fingers around my finger, so that is perfect. Do it on this side. Yep, she's doing that. Awesome. Now this is called the Babinski reflex. So what I'm going to do is just stroke the sole of her foot, and her toes should lay out like this, and they do. Same thing on this side. Great. The rooting reflex, that's where you kind of stroke the side of their cheek and they should turn their head in the direction that you're stroking. That's called the rooting reflex. And then finally, this one can look a little scary to parents, but what I'm going to do is called the Moro reflex. So I'm just going to lift her up slightly and drop. And she did great. She flailed out just like she was supposed to do. So other than that, I'm not seeing, she does not have a single palmar crease. She has 2, so that's great. Let's see, what else? Her eye shape and position, those both look good. I'm not seeing she has 10 fingers and 10 toes, so no polydactyly there. And no evidence of club feet. Her feet are nice and aligned. So that is it for the exam. You can go ahead and have your baby back now. Thanks so much for letting me look at her.